I'm Martha Neville. Time now for Sunday House Call.
And hello, everyone. I'm Eric Shawn. Welcome, as always. Joining us, Dr. Marc Siegel, professor of medicine at NYU's Langone Medical Center and author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi, chairman and professor of urology at Lenox Hill Hospital and chief of robotic surgery. Good to see both of you, Doc.
Hey, Doc. It's good to see you, as always. We start today with a stunning new study about binge drinking in our country. It shows that in some parts of our country, more than one-third of adults are consuming alcohol at, they say, dangerous levels. So, Dr. Siegel, how much is too much? If you down a bottle of vodka, down a bottle of Cabernet, one six-pack, 2 6-packs?
You're already way over it.
I mean, really, I'm thinking, who can handle that?
I want people out there to know that the number one problem is binge drinking. It's not steady drinking. Steady drinking is defined, Eric, as greater than 2 drinks a day per man, greater than 1 drink a day per woman. A lot less than you might think. Wow. Binge is 5 drinks at 1 sitting for a man, 4 drinks for a woman. Now, 18% of the time it's binge drinking. Only 8% of the time it's steady alcoholic type heavy drinking. So I don't think people out there realize that binge drinking is the number one problem. 90% of our youth who drink binge drink, and they think, oh, fine, during the week I'll study, on the weekend I'll tie one on. Guess what? It leads to car accidents, it leads to violence, it leads to sexually transmitted diseases, it leads to liver disease and heart disease, which I'm particularly worried about. From binge drinking, your heart rate goes up, your blood pressure goes up, you can have heart disease from this. It's a huge problem.
But it's nothing really new. Isn't this what college kids do? Many of them, this is why we're talking about this now.
Because the number of binge drinking among women is on the rise. We always knew about college students. And I have to tell you, we were all in college at some point. Binge drinking, it's sort of fun. It's a social lubricant. It lowers inhibition. You get to know the people. You come in as a freshman. You don't know anybody. And through taking these shots, you basically mingle. But what they don't understand is now we have 1,400 college students dying from binge drinking every year. And the short-term effect of it is, okay, I'm going to go home and drink some water and Tylenol. The next day I can go to work. That's not correct. It affects your brain and central nervous system. So study after study shows that the white matter in the brain, the activity goes down, you don't function enough. And if you overdo it, you can go into seizure and coma. This cardiomyopathy or heart disease is a huge problem as a result of alcohol. Triglyceride goes up. And you know what? How about liver? Liver cancer, esophageal cancer. So long-term effect of this is absolute a nightmare. You asked how many? 5 alcohol drinks for men in 2 hours. And 4 for women, because women don't have all the enzymes they absorb much.
So, Dr. Siegel, what would you suggest as a physician people should drink? Is it 1 glass of red wine or white wine? Is it 2?
Or
how much beer?
How many martinis or margaritas?
Here's the problem. There's tremendous variability all around the country. And Arthel, you were pointing out why we're talking about it today. State to state, there's variability. Some states, very little binge drinking. Some states and regions within states, a lot. And if I get on TV and say it's okay to have a glass of wine a night, you know what's going to happen? People will then say, Siegel says it's okay, now I'll have 2. Now I'll have 3. So I would like to say that not drinking at all is great. We have study after study that show 1 glass of wine may improve your circulation. That doesn't mean I'm recommending it. So I think the problem is that people underreport and have always underreported.
Oh, yeah. You go to the doctor and they have that list. And they always say, what doctors used to say, that you add, 3 or 4 drinks?
They've said that. Yeah, they've said that here.
Whatever the patient tells you, always double the amount of alcohol they're taking. But the message to a lot of teenagers out there is, if you have to drink, make sure that you eat some fatty food before you go to the party, because that absorbs some of the alcohol.
Like what?
You can have a slice
fries,
of pizza.
Yeah.
Have some fatty food. Drink a lot of water before you go in. And also watch your drinks. There's a lot of these things going on where you put your drink and somebody can put something in it. There's a lot of pressure on this kid. So I would say just go slow on this. But now, not only teenagers, we're seeing among adults, especially women, this is on the rise because of the pressure of what's going on in the society, etc. So this is something to be aware of.
It was so shocking. 1,400 college students. It is such a problem around the country, especially if you're a parent. Absolutely. I'm glad you mentioned that.
I want to emphasize something David just said, hugely important. Dehydration comes along with drinking. So I say two-fisted drinking, a glass of water in one hand and the alcohol in the other. You have to stay hydrated because otherwise it doubles and triples the effect of the alcohol. You can't clear it as easily.
And then quickly, you said something about parents. Parents shouldn't be so hard on their kids. So when they're at home and then so when they go to college, they just go crazy and drink like they're fish.
You know something? A glass of red wine once in a while, Arthur, is absolutely, it's okay. Socially, it's fine. It actually helps you to some extent. That's when you put a lot of alcohol in a short period of time is when you really can go into coma and problems. Yeah. So teach them before they go to college.
Yeah. Exactly.
All right,
okay.